Hey everyone, welcome back to ADUC Medical. Today we're diving into a topic that's incredibly important for roughly half the population, the menstrual cycle. Whether you're new to this or just looking for a refresher, understanding your cycle is key to understanding your overall health. Okay, let's begin. So let's start with the basics. What exactly is menstruation? In simple terms, it's your body's way of shedding the lining of your uterus, which happens about once a month. You know that time of the month when you get your period? That's menstruation. Now you might be wondering what comes out during your period. Well, it's a combination of blood and tissue from the inside of your uterus. This flow makes its way from your uterus through your cervix and then out of your body through your vagina. But here's the thing. Menstruation isn't random, it's actually controlled by hormones in your body. These hormones are like little messengers telling your uterus to thicken its lining and your ovaries to release an egg each month. If pregnancy doesn't happen, that carefully prepared lining sheds and voila, you have your period. Now that we've covered the basics of menstruation, let's zoom out and look at the bigger picture, the menstrual cycle. Think of it as a monthly series of events that happen in your body, all orchestrated to prepare for the possibility of pregnancy. The menstrual cycle starts on the first day of your period and continues until the first day of your next period. It's a continuous loop, always in motion. While the general process is the same for everyone with a uterus, every single person's cycle is unique. You might be wondering, okay, so if everyone's cycle is different, what's considered normal? While there's a range, the average length of a menstrual cycle is about 28 days. But don't freak out if yours is a bit shorter or longer. Anything between 21 and 35 days can still be perfectly normal. Here's another way to think about it. The number of days between your periods is essentially your menstrual cycle length. It's totally normal for your cycle to be a bit shorter, say 21 days, or a bit longer, like 35 days. As long as you're consistently falling within that 21 to 35 day range, you're good to go. Let's talk about the main event, your period. How long does it typically last? Most people bleed for about 3 to 7 days during their period. Some might have shorter periods, while others might have slightly longer ones. The key is to pay attention to your own body and what's typical for you. If you notice any significant changes in the length of your period, it's worth bringing it up with your healthcare provider. Absolutely. A 3-day period is completely normal and nothing to be concerned about. Remember, the typical range for a period is anywhere from 3 to 7 days. Some people are lucky enough to have shorter periods, maybe even just spotting for a couple of days. As long as your flow is consistent with what's normal for you and you're not experiencing any unusual symptoms, a 3-day period is perfectly fine. Okay, let's get a little more technical and break down the menstrual cycle into its 4 main phases. Think of these phases as the key players in the monthly production we call your menstrual cycle. First up, we have the menses phase. This is where the action starts. It's the actual shedding of your uterine lining, aka your period. It usually lasts for the first few days of your cycle. Next, we move into the follicular phase. This phase overlaps with the menses phase, starting on the first day of your period and continuing until ovulation. During this time, your body is busy getting ready to release an egg. Your uterine lining starts to thicken, creating a cozy environment for a potential fertilized egg to implant. Now, for the main event, ovulation. This typically happens around day 14 in a 28-day cycle, but remember, everyone's different. During ovulation, one of your ovaries releases a mature egg, which then travels down the fallopian tube, hoping to meet a sperm. Finally, we have the luteal phase, which lasts from around day 15 to day 28. If pregnancy doesn't occur, the lining sheds, and we're back to day 1, the start of a new cycle. For many, getting your first period is a significant milestone. It usually happens around the age of 12. But don't worry if you got yours a little earlier or later. It's totally normal for menstruation to begin anywhere between the ages of 8 and 16. Every body develops at its own pace. Menopause, which is when menstruation stops permanently, typically occurs around the age of 51. Let's be real. Getting your period isn't always a walk in the park. Our bodies give us all sorts of signs and signals leading up to and during our periods. Some of the most common symptoms include cramps, those pesky aches and pains in your lower abdomen. Then there are the mood swings. One minute you're happy, the next you're crying at a commercial. We've all been there. And let's not forget about the sleep disturbances. Whether it's trouble falling asleep or waking up throughout the night, our sleep can definitely take a hit. Headaches are another common complaint, as are food cravings. Suddenly all you want is chocolate and salty chips. No judgment here. Bloating is another fun one, making you feel like you've gained 10 pounds overnight. The good news is that the intensity of these symptoms can vary from person to person. Just like we change throughout our lives, our menstrual cycles change right along with us. From our teenage years to our 40s and 50s, our cycles go through different phases. When you first start getting your period, it's normal for your cycles to be a bit irregular. They might be longer one month, shorter the next, and your flow might be heavier or lighter than usual. But as you move into your 20s, your cycles tend to become more consistent and predictable. Your body has settled into a rhythm. However, as you approach menopause, your cycles might start to become irregular again. This is all part of the natural transition into menopause. Major life events like childbirth can also affect your cycle. We've talked a lot about how everyone's cycle is different, but when does a cycle cross the line from being unique to being irregular? Well, there are a few telltale signs that something might be off. First, if your cycles are consistently less than 21 days apart or more than 35 days apart, that's considered irregular. Similarly, if you miss your period for 3 months or more, that's also a red flag. Another sign of irregularity is having unusually heavy or light flow. Periods that last longer than 7 days are also considered irregular, as is bleeding between periods. If you experience severe pain during your period or any other unusual symptoms, it's important to talk to your doctor. It might seem like you're losing a lot of blood during your period, but in reality, it's usually not as much as it seems. On average, you can expect to lose between 2 and 3 tablespoons of blood throughout your entire period. That's about the same amount as 4 to 6 teaspoons. The key is to be aware of what's normal for you. If you're soaking through a tampon or pad every 1 to 2 hours, that's considered heavy bleeding. Passing large blood clots, especially those bigger than a quarter, is also a sign of heavy bleeding. If you're concerned about the amount of blood you're losing, don't hesitate to reach out to your healthcare provider. Tracking your period is like taking notes on your body's monthly rhythm. It's a simple yet powerful tool for understanding your cycle and noticing any patterns or irregularities. The good news is that tracking your period is super easy. All you need is a calendar or a period tracking app. On the first day of your period, simply mark it on your calendar or in your app. Continue marking each day that you bleed until your period stops. Then, count the number of days between the first day of bleeding from one cycle to the first day of bleeding from your next cycle. Tracking your period can help you predict when your next period is likely to start and identify any irregularities in your cycle. And there you have it, a comprehensive guide to understanding your menstrual cycle. We've covered everything from what menstruation is to the different phases of your cycle, common symptoms, and how to track your period. Remember, knowledge is power, and understanding your cycle is an important step in taking control of your reproductive health. If you found this video helpful, give it a thumbs up and subscribe to our channel for more informative content. Thanks for watching.